Hello, welcome to Dr. Julian Silva's signature vertical deep plane facelift and neck lift. So today I'm going to tell you everything that I have learned over the last 15 years of doing facial cosmetic and plastic surgery. And I've been teaching facelift surgery since 2016 to other surgeons on how to do the technique, the fundamentals of facelift surgery, and that includes lectures and cadaver dissections. And I'm going to tell you what I think currently gives patients the best possible results, what the recovery is, what the limitations are, how to avoid issues and risks, and of course, the little secrets that can make all the difference. I believe there's 7 key principles when looking at facial aging, and there's 2 key principles within this. One is we want the results to be natural, and the second is beautification. So there may be certain areas of the face that are more feminine, like the cheeks, for example. A more curvaceous cheek is a more feminine appearance. It creates something called the Auger curve that looks feminine and attractive. And there's certain parts of the face that could be more masculine, such as the chin and the jawline area, and certain actors, say like Brad Pitt, where he's so handsome because his jawline is so strong. So in terms of natural, well, we know what looks natural. It's when the face looks rejuvenated, it looks youthful, it's more V-shaped, there's no jowls, there's not deep folds like nasolabial and marionette folds. The eyes look fresh, but there are still a few little lines, there are a few little creases, so the face looks natural because there are still some lines, there are still some signs that look part of a natural face. So we don't want to remove everything, and it is that fine line between improving shadows but not overdoing things. And you can see this lady, she has a few lines in the neck, these neck bands and platysma, and then afterwards it's just softened and smooth. And one of the key things that changes with facial aging is your face shape. So when you're young, you can have a very nice V shape. And then what happens with facial aging, well, this is one of my patients where you can see like this area just dropped down. And as that happened, you ended up with more jowls, there's band in the neck, and these lines get deeper, the marionette, the nasolabial lines, and there's of course other shadows around the eyes, there's hooding around the eyes, and so everything has just dropped that little bit further with time. And really that starts at the brows come down, the eyelids, the cheeks, and the center part of the face can really change. So this face looks squarer with time. Now we can look also at the beautification of the face using something referred to as the golden ratio. The golden ratio is used since Greek times and a lot during the Renaissance period in a way to objectively measure beauty and develop beauty within art, within architecture and buildings, because these proportions are so key to natural beauty. And so in the past, my team and I, we've done a lot of research on the golden ratio and applying that to human faces and to measure attractiveness in certain areas. And of course, there are certain 3 things that change with time. There's gravity and descent, there's loss of volume with deflation, and you have loss of skin elasticity. Your skin becomes looser. And as these 3 things change, it changes the facial balance and it changes your facial proportions. So this is Bella Hadid, and Bella Hadid looks very much different to how she looked as a young teenager. And her face really changed. And in a way, the golden ratio can be used to objectively evaluate this in terms of beautification of the face. Now we can see her face is just rounder when she was younger, but it became more V-shaped. And the cheeks were more defined, and that can be done non-surgically or surgically, but surgically is much more powerful, like V-shaping the jawline, reducing volume such as the buccal fat, enhancing the cheeks like with cheek implants, shaping the eyes like improving the contours of the eye, lifting the tails of the brow like temporal brow lift. This wasn't absolutely necessary, but it beautified the face according to like parameters such as the golden ratio. In the past, we've applied it to lots of beautiful faces. This is Amber Heard, who scored very highly for certain levels of her eyes and her nose and facial proportions. Kim Kardashian, we can also apply the golden ratio. We can evaluate her eyes, her nose, her mouth, her lips. We can evaluate each of these parameters and look at how it correlates to the golden ratio. And we can apply those principles to where proportions are well suited and where the proportions could be improved. Zendaya, a naturally very beautiful woman, well, we can certainly look at certain aspects of her face and we can quantify that level of beauty. For example, looking at the width and the length of her lips and correlating to the golden ratio, we can see her lips correlate 99% towards the golden ratio. But there are other aspects of her face, such as low set eyebrows, and those qualities rate lower according to the golden ratio. And we can do this just about on anyone. I've done it on myself, and that can give you useful information. And what we know is because the face changes, there's loss of this V-shaped jawline with aging, the face becomes squarer. and this squarer face just looks more tired. Whereas when everything is lifted, the face looks V-shaped, which looks far more youthful, and a vertical deep plane facelift will restore the anatomy vertically upwards, which looks natural, and in this case it looks feminine. So what is a vertical deep plane facelift? Well, in a way, what we need to do is there's little ligaments, and these ligaments are like super glue. They glue parts of the face down, and particularly in the central areas of the face, but those ligaments are well defined in terms of anatomy and science. And what we can do with the vertical deep facelift is we can make scars hidden around the natural curves of the ear, and we can go under the skin, and we can release those ligaments, release that glue that's holding parts of the face, and then we can lift it up vertically. And as we lift it up vertically, it restores the anatomy to where it used to be. Now, traditional facelift surgery, smash facelift, and some deep plane facelift, well, it really lifts towards the ear. The advantage of doing that is it's a relatively straightforward technique, and I've taught that technique in anatomy and cadaver courses to other surgeons. However, because it's a more straightforward technique and it's faster to do, it doesn't lift the central area because those ligaments are just not released, and it doesn't lift upwards. Now, by elevating upwards, we can correct the changes of gravity, we can improve the nasolabial and marionette lines, and actually we need to do less in the neck because most of everything is lifted upwards. And I have a very specific technique where I use the temporalis fascia, which is very strong fascia, in order to lift the face upwards. And as we have looked at, the face comes down with gravity, so we need to lift it upwards. Now, this is a picture of Nicole Kidman taken where her face just looks slightly unusual, and that's because there's just too much volume that's been added to her face. And a little bit of volume, as we looked at, can look attractive and nice, but excessive added volume just changes the face shape. It makes it look rounder, and it certainly looks smooth, but it really changes someone's appearance because when they're more youthful, they don't have like a round face that's fuller in the jawline. And as I can show you in my patient, what looks just more feminine is this kind of very V-shaped jawline and a nice ogee curve to the cheek and lifted eyelids that look more open, and this looks like a natural youthful appearance. And I advise patients not to have too much non-surgically added in the form of fillers to the jawline or the cheeks because that really won't look natural. And for some patients that come to see me, we just need to dissolve all the fillers first of all in order to then find out where things have dropped and lift things back to where they used to be. The other consideration, well, we're talking about facelift surgery, but the neck is of such importance when it comes to the face because the two really change together. And you can see in this lady, well, the number one thing that you see is her neck. There's no angle between the jawline and the neck, and this is because the face has dropped down with gravity. So this lady, well, she needed a face and neck lift. Now, in her mind, initially when she came to see me, it was really the neck that bothered her. But as you can see, well, there's jowls here, there's deeper lines in this area, and it's really because the whole face has dropped down. And really to give her the very best result means lifting everything up to where it used to be. So in terms of the neck, what do we need to do? Well, although you can see skin and there's often a cushion of fat that lies beneath the skin, and those things we need to address, key importance is a muscle in the neck, and that muscle it's called the platysma, and there's one on the right side, there's one on the left side, and often the two are just very slightly separated in the middle, and because of that you see one or two bands in the neck. And so key to improving this area, well, the number one thing is lifting upwards, and that's really the facelift part of the surgery. And then the second part is just gently bringing those two muscles together and contouring that almost like a corset. But in a way, I don't like to tighten this area very much. I prefer to lift everything because otherwise it can feel tight in the neck afterwards, which is uncomfortable. Now, the other important consideration is scars, because really we want any scars to be discreet, difficult to see, and in a perfect world, virtually invisible. Now, my preference for making scars around the ears is to hide the scar along the very curves of the natural ear and right behind the ear. Now, some patients will need the scar extended behind the ear, and that's really if you have a lot of loose skin. If you have 3 centimeters of loose skin in the neck area, then you're going to need a slightly more significant scar in order to address that. And then the scar at the front of the ear, well, sometimes I will take that under the hairline here because we do not want to change that hairline. We want that hair, that temporal hair, to be in exactly the same place after the surgery. So sometimes we'll curve that scar under the hat. Where I would suggest people avoiding scars, and this is because at least 20% of the patients that come and see me have had previous surgery, and unfortunately often the scars are not ideal. Well, if the scar is taken in front of the ear, well, it can create a straight line that can be much more visible. And if it's taken too high up in front of the hairline, again, that can be more visible scar. So really we want the scar to be more hidden. And secondly, if the scar is too low behind the ear, well, you'll see the scar behind the ear. So it needs to be much higher up, and then it's more discreet. Personally, like a common scar is where the scar is made just perpendicular to the hairs. And my preference where there is hair is to actually have a beveled incision. And that beveled incision means that it's at an angle. Now, when it's at an angle, it means that when the scar heals, the hairs will actually grow through the scar. And so with time, over the first year, 18 months, the scar will get more discreet because some of those hairs will grow through the scar. So I would say, standard scar is fine, but a bevel scar slightly improves that where there's hair-bearing skin. So this is one of my patients. She was a younger woman in her 30s. She had hypermobility, so a significant amount of loose skin. And so the scar we can see is hidden along the curves of the ear and then under the hair. And so this is at 6 weeks after surgery, so it still is a bit pink. It's discreet, it's not invisible, but this scar would get better and better over 12 to 18 months, and eventually it'll be difficult to see because the pinkness will resolve. And here we can see a better view of the neck. We can see she's got loose skin, she's got a relatively small chin, and that's the indication for improving this area. She had hypermobility, which means that the collagen and the way you're made is just more stretchy, and so most of the younger people who come to see me for mini facelift procedures, they often have this hypermobility. So if I try and bend my thumb towards my arm, well, I can't go further than that. But some people just naturally can bend it so much more, which can be good in terms of flexibility, in terms of childbirth, but in terms of facial aging, often I find that these patients notice more aging at a younger age. Now, in terms of teaching facelift and neck lift surgery, well, I've been teaching since 2016 a course in the US, and that teaches international surgeons on how to approach facelift surgery. And after doing a period of lectures, we'll do cadaver dissections and we'll look at the anatomy. And SMAS facelift surgery has been used for more than a decade, and that technique is very good because it's straightforward, it's got good principles, and it avoids delicate anatomy. But I do feel that going within the deep plane anatomy gives a better lift, it reduces the amount of swelling, and it looks more natural and gives a better result. So now we're going to move on to face shape and structure. So in this lady, what we can see is her chin sits quite a long way behind her upper and lower lip. If we were to draw a line here, the chin sits further back, and her neck is starting almost at the position of her chin. Now, because her chin is slightly smaller, her neck often we can find that a lot of the soft tissues are concertinaed in this area, which can result in a less defined neck area. There's another one of my patients where I've drawn a vertical line down from her lips, and you can see her chin sits such a long way behind that lip. And as a part of the consequence of that, yes, there is aging where there's been gravity, the face has dropped, but also having a small chin concertinas some of the changes, the loose skin, the neck bands in this area, which generally don't look so nice. So what can we do about this? Well, if we can bring the chin forward with a chin implant, it will improve the contour of the neck and it will give a better result. Now, key, in my opinion, is the implant has to be sculpted to match the jawline of the patient. Because if we just put a standard implant in, particularly in some patients, it will make the jawline squarer, which can make it more masculine. And so some patients will potentially prefer that, male patients, but certainly in women, I will shape a lot of the implant because we want the implant to be more V-shaped, which looks feminine and youthful. And so this is the same patient. This is about 2 months after surgery, and we can see, well, her chin has been brought forward. At the same time, she's had face and neck lift procedure, and I've contoured the neck and see a much better angle between her jawline and neck. And this lady, well, she was a bit anxious about the principle of having a chin implant initially, but I explained it how we've been talking now, and she was incredibly grateful afterwards because she found that it made a really significant difference to this area because it just gave her better facial balance and harmony. Now, in this, going back to the patient that I showed you, well, bringing the chin forward, what did this do? Well, it gave her better jawline, it gave her a better angle between her chin and her neck. In medicine, it's called the cervicomental angle, and this just looks like youthful and refreshed. I also sometimes find that patients with smaller chin chin also have like a little bit of additional volume, like in the lower jawline, and where it's described as the buccal fat area. And so sometimes having a small chin and more prominent buccal fat can go together. In some patients, if we can just reduce some of the volume in this buccal fat area, we can enhance the V-shaped jawline, which looks so youthful and attractive. So let's have a little look at the buccal fat, because this fat is like a fat pad that just sits in this very specific area. If we were looking to reduce that in a younger person who had no facial aging, we could actually take the buccal fat from inside the mouth. We can make a small scar about 1 centimeter long, and we can identify that buccal fat and we can reduce it. Now, key with reducing buccal fat is we only want to reduce it. We certainly don't want to take out the entire buccal fat, because that will go from being slightly fuller to actually being slightly hollow. So we only want to reduce the volume in that area to make it just smoother and more even. What does buccal fat reduction do? When buccal fat is more prominent, it tends to make the face squarer. And by reducing the buccal fat, it tends to enhance a more V-shaped face, which I would describe as beautification of the face. So now let's talk about eye appearance. So this is the third parameter in the vertical restore 7. The three things that we've talked about in terms of facial aging: there's gravity, the temporal brow tends to come down with time, there's some loss of volume, and that can be like fat in the temporal area, and there's some loss of the skin elasticity. And so all those three elements means the brow can sit lower, there can be hooding of skin in this area, and there can be thinning of the temporal fat area. This is a patient of mine where this was lifted and it restored a more kind of nicer shape to the brow. It lifted the hooding over the eyelids, and at the same time it looks natural. Lifting the tail of the brow, well, what does that do? It tends to reduce some of the lines and hanging of soft tissues at the outside of the brow, and that tends to freshen up the brow and beautify the face. And this is another patient of mine where you can see there's this hooding of the tail of the brow is lower. And then by lifting the tail of the brow up, and this is only like a few weeks after the surgery, so still there's a bit of swelling and lifting in this area that would all improve over a period of weeks. But what that does is means that there's less hooding, there's less kind of lines in this area because it's been lifted up. Some patients can also benefit from eyelid surgery, also known as blepharoplasty, and that means hiding a scar in the natural crease of the eyelid, taking away a small amount of the loose skin, taking a small amount of fat away, and what that will do is just open up and soften the appearance of the eyes. Blepharoplasty and brow lift surgery, one can really change a person's appearance. Now, a few years ago, Renee Zellweger, there was a lot of media attention drawn to her because she looked very different. And it was thought that at this point in time, she had a brow lift procedure that just overlifted and over-opened her eyelid area. And that's true for many celebrities who look like they've had a bit too much surgery or a bit too much done. The eyelid area can be changed. And key with natural looking surgery, particularly with celebrities and A-list celebrities, is we want things to look natural. And that means not overlifting areas and doing more preservation eyelid surgery and focusing on lifting the tail of the eyebrow as opposed to the entire brow. Because if the entire brow is lifted up, it can change a person's appearance to how they look younger. Now, with Renee Zellweger, as a young woman, she had quite full eyelids, and full eyelids meant that you could only see a small amount of the eyelid. And although women are often thought of as having high arched eyebrows and very open eyelids, many beautiful women have lower eyebrows and fuller eyelids. And key with any natural looking eyelid surgery in Renee Zellweger is less is more, is that taking a small amount of volume and lifting just the tail of the brow will make it natural and much more difficult to see. When we look at the eyelids, what lies underneath the skin is these cushions of fat. And these cushions of fat, orbital fat, can come forwards through the eye with natural aging. And lower eyelid surgery, well, often those fat pads are more prominent and we want to reduce those. Now, of absolute key importance is we do the surgery on the inside of the eyelid because that preserves the natural anatomy and avoids the risk of eyelid retraction, which is a very feared risk of lower blepharoplasty. By doing the surgery in this way, we preserve the natural eyelid, the middle anatomy of the eyelid that protects from those kind of issues. So this is one of my patients who I did do face and neck lift surgery for, but the eyes also look quite tired. We can see loose skin in the upper eyelid, there's puffiness which is caused by this fat creeping forwards, and in the lower eyelid, similarly, there's loose skin, puffiness, and so improving this area with upper and lower blepharoplasty combined with CO2 laser, and often I'll do a little bit of fat transfer, that will improve this area and she looks so much fresher and natural. And this from another angle, we can see that there are these kind of loose skin and lines around our eyelids that just make a tired appearance, and then afterwards it's just smoother or more even and it just looks natural. This is one of my patients who was in her 40s, and she had this fat that was creeping forwards in the lower eyelid that created this puffiness, a deep ring under the eyes, and loose skin and lines in the upper eyelid. And a combination of the upper and lower blepharoplasty, taking away some of that loose skin, using fat transfer to smoothen out this contour on the eyes, and I'll talk about that a little bit further along, and improving the skin quality. So using an advanced CO2 laser, well, you can see there's lots of kind of lines in this kind of skin here. And then afterwards, by using a laser, well, it's the same skin here, but by you treating that with the laser and PRP, it's smoothened out the laser so it just looks more even. And sometimes when I just do eyelid surgery for patients, we'll treat this area with CO2 laser, and on another occasion, often those patients will come back to me and we'll do full face CO2 laser, because that will improve all of the skin. And here we can see, there's hooding along the eyelid, there's puffiness and a deep ring under the eye, and afterwards, well, the eyelid is more open, the skin is smoother, and there's a kind of very fresher appearance to her. As facial aging occurs, there is some loss of volume, and we could be really grateful to research done by Rod Roddick and John Pesser, who found that there are these fat compartments that line the face. These anatomical fat compartments deflate with time, and they do differ from person to person. And as this volume comes down, the face can look thinner and more gaunt. And this is one of my patients where we can see the face has lost a significant amount of volume in the temple area, in the face, the cheeks, the lower face, the jawline. And so this loss of volume can be restored in several different ways. Non-surgically, we can use artificial fillers, and that can be really helpful because literally you can sit in a chair and have fillers put in, but caution, because you don't want to have excessive amount of fillers put in because it will just make your face round. And fillers generally will last for about a year and then they need to be replaced. So sometimes that's not the best for a long-term solution. When doing face and neck lift surgery, well, we can look to do something that is more long-term. We can do something called fat transfer, and I'm going to explain that to you. And sometimes we can use implants that we can put in very specific areas of the face, like the cheek area, the chin area, and that just restores volume, but it simulates bone. So in a way, particularly if you've got like a small chin, an implant can simulate natural bone and just give you better facial structure. Now here we can see how fat can change with time, and this I've taken from my own book on face and neck lift surgery, like a patient guide to everything you need to know about facelift surgery. And what we can see in this is that as you age, decade after decade, there is some loss of volume in very specific areas in the face. What can vary significantly is each of us is different, and some people will have more loss of volume, some people will have less, some will have volume that is lost in very specific areas. So in a way, volume replacement really needs to be tailored to the individual person. So one technique that I've been using for more than a decade is fat transfer. Now, fat transfer means taking fat from a very specific area, and usually I will take it around the belly button. That means making a tiny mark just on the inside of the belly button in order to just take that fat. And when we take that fat from this area, there's no scars because the only mark is on the inside of the belly button, and we concentrate that fat and then put it in very specific areas of the face. Now, in between that, we use a machine that will spin and concentrate the fat. And the process by which this fat is made is so important because we want consistency. And from my experience, 50 to 60% of that fat will survive long term. And I've seen some of my patients even 9 years after surgery, where in specific areas like the lower eyelid and upper cheeks, the fat has lasted even that period of time. However, the process is so important because if the process is different, the fat may not be consistent and different amounts of fat can survive. Now, we never want to overdo this because, as we were talking about, volume loss is just one of the three main elements of facial aging. The others being gravity, the skin becoming looser. So we don't want to overfill the face because it won't look natural. So it's always better to be a bit conservative when it comes to fat transfer. Now, in terms of fat transfer, where do we do it? Well, we do it where the individual person has lost volume. And so I can look at an old photograph and I can use that old photograph to guide where fat can be put, and also discussion with the patient and where they notice some of these changes. And with every patient I see, we take high definition photographs, we look at those photographs together. As we look at those photographs, we can see where there's shadows and loss of volume has occurred. Common areas where we can put fat are in the lower eyelid and cheek area, nasolabial and marionette areas, but then there are also other areas. Like sometimes I will put some fat in the upper eyelid area, often to improve symmetry. In some people, about 5% of patients I see, there's hollowing on one side and fullness on the other, and we can use fat transfer to rebalance that asymmetry. Some patients can need some volume in the temples, and then very specifically, if you have any injuries or scars, well, fat has incredible qualities with regenerative cells within it to repair some of that previous trauma and damage. And that is one of the unique qualities of fat transfer. It's not just the volume of the fat, but within your natural fat, there are these regenerative cells, and they're not true stem cells because true stem cells only exist in your bone marrow, but they have some of those properties, so they tend to improve the skin quality, they tend to make the skin smoother and more even with time. And that's really over 9 to 12 months you can see the changes in the quality of the skin. So in this patient that I showed you earlier, well, in addition to doing face and neck lift surgery, I also did fat transfer, and we can see how that really restored some of the volume to these areas of the face and made her face much more youthful and smoother and more even, and gave a really nice natural result. I showed you this patient previously, and fat transfer in the lower eyelid is a very powerful tool to improve this area. Now, some doctors don't do fat transfer and don't use it around the eyelids because it is a quite delicate technique. The fat has to be very, very finely processed because we definitely don't want to see any lumpy, bumpy or irregularity in this area because the skin is incredibly thin. The skin here is actually less than 0.5 millimeter thick, so the fat needs to be very fine, and so the process by which it's made and refined is so key to giving it a natural and long-lasting result. And now let's look at the philtrum, because the philtrum is an interesting area because the philtrum is an area that is defined as the distance between your nose and your upper lip. And what happens with time, in some individuals, this distance lengthens. And as this distance lengthens, it just reduces the balance in facial proportions. And in a number of patients, if we shorten that distance, the philtrum, it lifts this area, it rotates the lip so the upper lip looks that fraction fuller, but it beautifies the face. It just enhances the natural appearance of the face. Key is looking at old photographs to see how this area has changed, and key is consideration of what has changed in this area and also asymmetry, because sometimes one side will be lower than the other, and so there's a delicate balance between shortening this area and also improving asymmetry. And we can see in this area as it lengthens, the upper lip can look thinner with time, and it just reduces the facial proportions in this area. Now, classically, a lip lift means this bullhorn markings underneath the nose that leaves this scar that's hidden as shadows under the nose. And the scar is definitely a very important consideration because we can be meticulous, use multiple levels of stitches, we can take out the superficial layer at 1 week. However, there's a level of genetics to how scars heal. And in some people, scars will heal incredibly well. In other people, the scars can be more troublesome. And I would be quite cautious about doing this procedure in patients who have had not insignificant scarring or keloid or hypertrophic scarring, because we wouldn't want a scar in this area to be troublesome. But in some patients who heal well, whose scars are difficult to see, this can be a really effective tool in beautification of the face, because shortening this distance just improves facial proportions. Now, 1 week, any scar can be a bit pink, and it can be a bit lumpy bumpy, and this can vary a lot from individual to individual. But as we can see, by 6 weeks, that scar is really healing well, and it's already getting discreet and difficult to see. And going further forward, the final result for any scar can be as long as 12 to 18 months, and then scars can be virtually invisible to see. So now let's look a little bit about skin aging. Now, what changes in the face with skin aging? The 3 classical things that we tend to notice is pores tend to be enlarged, there tend to be accumulation of fine lines and wrinkles in the skin, and there's also sun damage. And sun damage is visible as areas of darkened skin, also known as hyperpigmentation. And these changes are often acquired with time, and a lot has to do with sun damage. So laser resurfacing is a powerful tool by which we can rejuvenate like the skin. And what it does is it fires like laser into the very superficial layers of the skin, and what that will do is it will trigger collagen production in those areas. What does that do to the skin itself? Well, it improves the quality of the skin. So it reduces the fine lines, improves like the pore size, reduces like pigmentation from sun damage, and it just smoothens over the face. Now, in first face and neck lift surgery, well, the most important thing is lifting the face, because that's going to restore the anatomy to where it used to be and take away the loose skin. But a bit like the icing on the cake, laser resurfacing is important because it's what you will see afterwards. Now, 1 week, the skin can be quite pink after the surgery. However, we can use very specific tools, and I'm going to come on to those, to improve how quickly the skin heals. So using regenerative medicine, using radiofrequency, it will heal you faster from laser resurfacing. Radiofrequency, what this means is a machine that will pass little microneedles 2 to 4 millimeters beneath the skin, and these 2 to 4 millimeters will then stimulate collagen in this area, and that collagen will continue improving the skin for several months after the surgery. Now, in addition to that, we can use regenerative medicine, platelet-rich plasma or PRP, that will encourage the body to heal faster from the laser. So I tend to use laser resurfacing with radiofrequency with PRP to give the best overall results. What can we do to improve recovery? Well, there are a number of tools that we can use. We can use lymphatic drainage, we can use oxygen therapy, we can use regenerative medicine, and we can use LED or light technology, and all of these have got good scientific evidence for improving how quickly the face heals. Some years ago, Kim Kardashian had PRP treatment to her face. It's advertised in the US as the vampire facelift. This is a sophisticated PRP machine that spins and then spins again the PRP. And what difference does it make? Well, it speeds up how quickly you heal from laser resurfacing. It can be used as a treatment in its own, but I tend to use it in combination with laser resurfacing and radiofrequency because it amplifies how quickly you heal and it improves the skin quality. So here are some patients that I've treated in the past, and we can see these lines around her mouth can be quite difficult to treat. These are like deep lines around the perioral area, and so using a combined treatment, it just smooths out and stimulates collagen in those areas. I advise patients that we can aim for a 50% improvement in this area, and sometimes we need to do a secondary treatment to improve this area further. Another patient with perioral lines, and we can see how it's just smoothed out and refined these areas and made it more even. This patient, well, she had eyelid surgery, but she had a lot of aging in her skin, a lot of lines and wrinkles, and this really improved these lines, making it smoother and more even. It smoothens out the areas of lines and wrinkles, and I often use laser, radiofrequency, PRP in combination with facial surgery like face and neck lift surgery and blepharoplasty to improve the results. So how can we improve or enhance recovery after facelift and neck lift surgery? Swelling is the number one thing after healing, and this is one of my patients who is, well, I've just taken off the bandage, and so this is less than 24 hours the following morning after surgery, and we can see already there's an improvement in the neck and jawline, but there certainly is some degree of swelling and there is bruising in the neck. Less than 24 hours, well, you can expect a degree of swelling and bruising because that is just how the body heals. But then at 1 week, you can see some of the more swelling has gone down, more of the bruising has gone down, and by 6 weeks, well, a lot of the swelling and bruising has resolved in this patient. But how do we do that? Well, to reduce swelling faster, we need to use what we know in terms of science, and that's partly with medicines like anti-inflammatory medicines. It's partly with the type of anesthetic, using sedation or twilight anesthetic. It means things like your vital signs are stable during the surgery, which means that you tend to have less swelling and bruising. The technique, well, vertical deep plane facelifting, my technique, it actually reduces the amount of swelling because there is less skin flap as opposed to older techniques with facelift surgery, and older techniques tended to give more swelling. Well, things like blood pressure can certainly make a difference, and we certainly want your blood pressure to be normal, but if you have low blood pressure, actually that tends to be favorable because you tend to have less swelling. I like to use a special cooling mask the first night after surgery because that cooling mask can help reduce the swelling further. And then also there's a type of massage. Lymphatic drainage can literally push away swelling from your face and heal you faster. Now, I give all my patients quite detailed instructions on what to do before and after surgery to encourage a smooth journey and fast healing. And they're quite detailed, and just to pick out two things, well, smoking can be really hazardous for facelift and neck lift surgery, so it's very important to stop smoking before and after. Alcohol, E2H, well, alcohol can affect because it has natural blood thinners, and it can also make you more dehydrated, and so blood thinners give you more bruising and swelling, so that's something we want to avoid. Drains, did use drains because there was a belief that putting a drain was like having a vacuum and it sucked away swelling. But for some time now, I've reduced, or I don't use drains except exceptional circumstances. And that is because what we're doing is using a more technique called netting stitches. And that technique, although it doesn't look beautiful immediately after the surgery, it actually stops the swelling from occurring. So once those little stitches are taken out, and that's only at 2 days after surgery, the face heals quicker with less swelling. And that advantage of that is you can get back to social activities, you can get back to professional activities much sooner if we can reduce the swelling faster. Lymphatic drainage, well, this is a skill technique that can literally push swelling down your lymphatics and drainage system. And they're trained specialists who are skilled in those techniques. I have a member of my team in my staff who's able to do those treatments because ultimately we will do whatever we can to heal our patients faster. Now, to make a mention about certain risks, well, serious risk after surgery is skin necrosis. Now, the commonest cause for skin necrosis is not enough oxygen going to the skin, which would be caused by things like smoking. But skin necrosis can happen in anyone. And what does it mean? Well, if there's enough oxygen going to the skin can be much darker or even black in color. And because there's not enough oxygen going there, well, we need to use oxygen such as hyperbaric oxygen or an oxygen chamber to heal the skin faster. Now, I have an oxygen chamber in my office because I want my patients to heal faster. And although these things are not common, it means that if there is anything like this, we can take steps to heal you faster. Statistically, the chance of a hematoma occurring in facelift and neck lift surgery is anywhere between 8 and 12%. The hematoma is a collection of blood, either the size of a tennis ball. It's frustrating because that can require multiple treatments, drainage of the fluid, and ultimately that can require sometimes further surgery if there's a very significant amount of swelling. Now, with our technique, vertical facelift procedure that's done under the deep plane, using everything that I've described to you, like sedation anesthesia, things like the netting stitches, well, actually the chance of like a hematoma, it's not 0, but it's 1% or less. So we really have reduced the chance of something like that happening. One type of nerves in the face are motor nerves that give you movement. And those motor nerves, we know where those motor nerves lie. They lie within the parotid, and then they branch out. And although we can avoid those very specific areas with face and neck lift surgery, there is always a chance of stretching a nerve or swelling around a nerve. And something like that can be frustrating because even though the nerve can still work afterwards, it might work only 70-80%. And although it will improve, it tends to improve slowly over several months. And there are things that can be done to help. It can, in terms of support, in terms of stimulating the nerve, regenerative medicine, anti-inflammatories. However, to some part, the nerve recovers itself. It just takes a period of months for that to fully happen. So that can be a frustrating thing after facelift and neck lift surgery. Oxygen therapy can be a very useful tool to help with healing. Certainly, patients with serious medical conditions can be healed with oxygen therapy. And what happens, it's a bit like when an aeroplane lands, is that there's a chamber of oxygen where the pressure goes up, so you need to equalize your ears just like as a plane lands. But once that's done, it tends to be quite a comfortable and relaxing experience. The oxygen chamber does have kind of anti-aging and healing properties, and so there are some professional athletes that use home oxygen therapy. Personally, I do use it myself because it has anti-aging and healing properties, but we specifically use it after facelift and neck lift surgery to encourage the soft tissues to heal faster, although it can also be an important treatment for things like skin necrosis. Light therapy, LED therapy, well, this has become an important part of healing of the skin because that light therapy involves 3 different light emitting diodes that are absorbed into the skin and they stimulate healing. Now, we have a sophisticated machine in our office that creates 3 types of light: red, blue and infrared, and those lights are made in a very large machine that is quite powerful, and 20 minutes under this light it will improve your skin quality, but after surgery it will heal you faster. Regenerative medicine, platelet-rich plasma, AMP, well, these are tools that we can use to heal your body faster. Now, taking your own blood, we can put it in a machine that will spin and concentrate your own growth factors, and putting that into very specific areas, it will heal you faster. So what common thing would be in terms of professional sports, Tiger Woods has had multiple joint injuries, and he's had PRP, his own PRP, injected into those joints to heal him faster after those injuries. We use platelet-rich plasma to heal parts of the face faster, but also it's an effective tool to improve skin quality. And so using it in conjunction with things like facelift surgery can help with scars, it can help with healing. There is evidence that platelet-rich plasma can improve healing and speed up healing, because essentially PRP is your own growth factors. However, the quality of how that PRP is made, the sophisticated machines that are used to make the PRP can determine how high that quality is. A very simple, cheap machine will not make the same quality of PRP, and hence the results will not be as good. A proportion of people do need a revision surgery to get the very best results, and that is just the truth. This is one of my patients. She had quite a lot of laxity and changes in the neck, and after face and neck lift surgery, there was a good improvement at 2 months, but there was still a little bit of laxity. And at 1 year, overall, there was a very good improvement in her face, her neck, However, there was not perfection. And for some people, this will be good. Patients will be happy. Patients will see a very good improvement. But then for other patients, you may feel, well, they still notice that little bit of laxity. And for this lady, well, I did a further surgery, and that further surgery, well, that just improved that to a different degree. Well, the final part of the vertical face restore is maintenance. What do we need to do in order to maintain this for longer? Now, in a way, you don't need to do anything. You can just have face and neck lift surgery with the other parameters that I mentioned, and you will get a very good improvement. However, if you do certain things on an annual basis, it will mean that those results last for much longer. Lifestyle, nutrition, regular exercise, these are of key importance. Lifestyle, I mean having healthy lifestyle, using SPF, sun protection factor, avoiding a lot of sun, because sun causes a lot of damage to your skin. So using SPF like 30 or 50. Nutrition wise, well, having a balanced healthy diet does make a difference. There's some evidence for collagen supplements can help, particularly if you have hypermobility, it preserves more collagen. Lines generally with movement occur with natural facial aging because there's some thinning of the skin. And commonly there are three areas: lines in your forehead, lines between the brows called number 11s, and lines around the corners of your eyes called crow's feet. Those three areas are very effectively treated with botulinum toxin and straightforward to do. It takes maybe 15 to 20 minutes. You can walk out of the procedure and do things like normal, and it will last for about 4 to 6 months, and then often you need to repeat the Botox. But certain areas like the forehead, the more regularly you do it, the longer the Botox can last. We talked about how you lose some degree of natural volume with time, and although with facelift and neck lift surgery, I often do fat transfer and that restores some of the volume, every year after that you will lose a little bit of volume. And if we use some degree of fillers just to add a little bit of volume in very specific areas, it can enhance the results for longer. And this patient of mine, well, I did a little bit of fillers in what I call the phi areas, and the phi areas along the cheekbone, the nasolabial, the marionette kind of areas. It just smoothens out these areas and it will preserve face and neck lift surgery for longer. Radiofrequency, well, Judy Murray had this treatment, and radiofrequency is a technology that tightens 2 to 4 millimeters beneath the skin. Now, it isn't going to correct if you have 2 or 3 centimeters of loose skin. It's just not going to make enough of a difference. But after face and neck lift surgery, every year the skin can get fractionally looser, and so it might be after a few years, if you have a radiofrequency, it will just tighten the skin that bit more, and it will maintain the results of your vertical deep plane facelift for longer. How does this technology work? Well, it passes little micro needles just beneath the skin, and radiofrequency then stimulates collagen. It can be done under topical anesthetic. My preference, well, under topical anesthetic like cream, the limiting factor is it's uncomfortable, and often patients need 3 treatments 6 weeks apart or so. My personal preference is patients to have a little bit of sedation and then just have one treatment that uses a little bit more energy, and that will give a good result. Skin resurfacing. Well, skin resurfacing means using laser technology to improve the quality of the skin. I have like a sophisticated laser that works on 2 different levels, superficial and deep. And what we can do is we can use the laser to polish the skin, polish fine lines, enlarge pores, pigmentation and sun damage. It will improve all of those. Now, skin laser resurfacing, it does have a bit of recovery. Like, you need to have about 10 days where you're not going to see too many people socially and professionally, but it can make a really significant difference because every year you acquire more damage to the skin. And this is one of my patients where there's a bit of pigmentation, there's fine lines, there's enlarged pores, and after the surgery the skin just looks smoother and more even. Platelet-rich plasma, taking some of your own blood, spinning and concentrating your own PRP. In the US, it's advertised as the vampire facelift. Kim Kardashian previously had it, and that treatment will improve your skin quality, and so that can be done as a treatment on its own. Now, of course, there are other treatments that are constantly being evolved. Ultrasound, cool devices that cool the skin and stimulate collagen, heating devices, threads. More recently, there's been polynucleotide treatments, and these treatments, well, some of these make a difference. Some of them are in the early stages, so in a way we will find out over time. So these are a few of my patients that I've done vertical deep plane facelift and neck lift procedures for, often combined with other procedures such as laser, such as fat transfer, and that's what makes up the Vertical Restore 7, is looking at the face as a whole and giving the best possible treatments that will improve each individual. So some patients, well, the most of the changes may be in the face and neck area, like this lady, where she didn't need any extra volume. She had good volumization in her cheeks. However, it was really the neck and the jawline that really needed improvement with a chin implant. In men, well, consideration is given to how the face has changed. This patient, well, has a lot of changes around the eyelids, and we can see that he just looks like more youthful because the eyelid area has been rejuvenated at the same time as face and neck lift surgery. And we can use natural lines and scars to hide the scars, because often my male patients are quite concerned about visible scars, so we can hide those scars around natural lines. So the vertical deep plane facelift and neck lift is a technique that I've really developed over more than 10 years. And the principle is to lift naturally the anatomy to where it used to be. It is a more advanced technique because it means understanding the deep anatomy of the face and neck and releasing ligaments in order to restore the anatomy to where it used to be. And in a way, there are no shortcuts. It does take time to do that, but ultimately it gives a longer lasting result that looks natural. And of course, it can be combined with other lifting areas of the face to give the very best results. Are there risks? Well, of course, all facial surgery has some risks, but by lifting up, we need to do less surgery in the neck, so the neck tends to be less tight. Hematomas, although uncommon, they absolutely can happen, but generally we've reduced that risk from 8 to 12% to less than 1%. Recovery, well, the number one thing with recovery is swelling. And swelling, there are techniques that we can do that we've discussed that will help reduce the swelling faster. And finally, we've advanced like sedation and twilight anesthetic. So we now do all facelift and neck lift surgery under sedation, avoiding the risks and side effects of general anesthetic. I would say the number one secret that I have for giving natural results is I ask my patients to bring old photographs. And because although we know that all patients have some degree of gravity, loose skin, loss of volume, we can actually look at this old photograph and we can study it and we can see how each individual person has changed with time. And this lady, well, we can see that she always had these nasolabial folds. These were even seen when she was younger in her 30s, but the changes in her neck, the bands in her neck, the changes in her eyelids, the hooding, these are things that have changed with time. And by specifically adhering to those things and doing the vertical face restore 7 and applying that to these principles means it looks completely natural. Now the second thing is applying the golden ratio to beautify the face, because we know your face changes with time and aging, but there's certain areas that can look more masculine, look more feminine. So where can we enhance things to make things look more natural? So this lady I did more procedures for, and not everyone will want as much change. Some people want it more conservative, but this lady wanted more change around the cheeks and the jawline, and so we improved all of these areas using the principles of beautification and the golden ratio to give her a really good result. And the third important thing is the journey. And I advise my patients, well, the number one thing is safety. And before doing surgery, we ask our patients to fill out a long medical form. We do certain tests before surgery because those are really important. Some are blood tests, checking your blood pressure, because safety is the number one thing. Then secondly is giving you the best natural result. And of course, this is an attention to detail on how things have changed with time. Looking at old photographs to see how things have changed naturally, and then also applying the principles of the golden ratio in terms of facial beauty and attractiveness. And the third thing is the best possible experience. I have a high quality team that are very skilled in providing support, education in the journey of facelift and neck lift surgery, because I would say that is really important because it is an emotional journey and healing is not a straight line. We need to provide that support to give every patient the best possible experience. And the reality is really good team members are really challenging to find, and for some of my team we have actually spent more than a year trying to find the best possible person for that role. Dr. Julian Silva's vertical face restore 7, what does it mean? Well, it's about lifting and reversing gravity, lifting in a natural way, restoring anatomy to where it used to be. It means using the golden ratio as a principle of beautification, enhancing beauty at the same time. We often extend the surgery to the central part of the face because those are the areas that kind of drop down with gravity, and sometimes that means removing filler that has been placed in those areas. It does take additional time to do this surgery, and that's because it's delicate, intricate procedures. I tend to do more lifting and less tightening of the neck, so patients can have a more comfortable recovery experience. Although risk of hematoma is always present, by taking all the steps that we've talked about, we can generally reduce that risk to 1% or less. And there are many things that we can do to enhance how quickly you recover after surgery. And although swelling is the number one thing, there are many things that can make a difference to that journey. And then the final thing is avoiding general anesthetic and the side effects and risks associated with that. We have a patent for our formulation because it is unique, and we've refined that over more than 10 years. Over the more than 10 years that I've been doing this, I have now over 1,000 5-star reviews, and I'm grateful for every single patient who's been so kind enough to write a review about their experience. I would love to say that all my patients are delighted with surgery. I would say overall 98% of my patients are super happy. There's 2% that are more difficult to please, and there is a small proportion of people that I'm not able to achieve their level of expectations. The 7 principles of the vertical facelift restore are: improve the face of the jawline, and that requires the vertical deep plane facelift. Improve the shape and squareness of the face, and that can be reducing buccal fat and using a chin implant. Looking at the eyes, and where necessary, completing preservation and blepharoplasty and lifting the tails of the brow. Looking at the mid-face, restoring volume with fat transfer or implants where necessary. Looking at that distance between the nose and the lip, and if necessary, completing a lip lift in order to restore that natural harmony. Looking at aging of the skin, and where necessary, doing skin resurfacing to improve the quality of the skin, the gold standard being a CO2 laser. And then enhancing recovery and sedation, so things like twilight sedation anesthesia, using oxygen therapy, using regenerative medicine, all aimed at improving patient experience by improving recovery. And then the final thing we talked about was how to maintain the results of surgery in the years after having a vertical facelift restore. I do hope this information has been helpful for you, and I do thank you for watching. And if you have any questions or thoughts on this, please do not hesitate to contact me.